Good morning, ladies and gentlemen. This is Frank Comito from the Caribbean Hotel and Tourism Association, and thank you for being patient with us. We had reached a max, which is quite over 100 folks, and so we had to do a little tweaking to get this going. But thank you for your patience. On behalf of our organization and our partners, the Caribbean Tourism Organization and the Caribbean Public Health Agencies, I would like to welcome you to the Mitigating the Impact of the Coronavirus on Caribbean Tourism Residents webinar. As a reminder, this webinar is being recorded, so you will be able to, we'll share it with you afterwards. We'll share it with members in general afterwards. So if for those that have not been able to get on because it's been oversubscribed, we'll certainly get the info out to you. These are member benefits. If you've not updated your profile or paid your 2020 dues, please do so after the webinar. Also, we hope to see all of you, or many of you, in Miami for our upcoming Chief Conference taking place June 26th to the 28th, and Taste of the Caribbean event taking place in Miami on June 26th to the 30th. Early bird registrations will be out soon. Before we proceed with the webinar, let's go over a few housekeeping items. This presentation is being recorded and, as I said, will be distributed. Outside of the main presenters, all participants have been muted to avoid disruption from latecomers and minimize distractions. If you have any questions during or after the presentation, please send them via the chat box to our CHTA host, Alexis, and they will be answered in the order in which they're received during the Q&A section. The webinar will last just about 1 hour. As we get started, this strain of the coronavirus has come upon us quickly, and it necessitates a quick response from on how to mitigate the impact, both from the point of perception as well as reality. It's a very serious health threat, which is impacting lives, and as well, it has the potential to severely impact tourism globally. Just last week, Adam Sachs, the president of Tourism Economics, said that basically a 25% in Chinese visitors to the U.S. means a loss of 4 million hotel room nights and $5.8 billion in visitor spending, and ultimately, as it ripples, over $10.3 billion in spending through 2024, and that's just for the United States. Now, less than 100,000 Chinese visit the Caribbean, mostly to Cuba and followed by Jamaica and the Bahamas. But never, and while there have been some flight cancellations and there are checks and balances on people traveling from the most impacted areas right now, it's still a threat, and it requires diligence and perseverance on our part. So what we're going to do today is basically understand the facts, and CARPHA, our partner, will walk us through the various facts behind the virus, and following that, they will basically speak to advancing how we better advance proactive measures by destinations, companies, employees, and travelers, and some of the tools that they put together to be able to help do that. And as well, we want to enlighten you even more about their confidential reporting system, which over 200 hotels are participating in, but we believe that every hotel should be participating in as well. It's an easy sign up, and it's a great way to monitor things in a very confidential way and nip things in the bud, hopefully, should something occur, or clarify whether or not it is something related to the strain of the coronavirus. So without further commentary on my part, I'd like to turn it over now to and introduce Dr. Lisa Indar, who's the Deputy Executive Director for CARPHA and also heads up their tourism health program. So Lisa, it's all to you now. Dr. Indar.
Good afternoon, good morning, everyone. Can everyone hear me?
We hear you.
Okay, great. Welcome. I would like to thank the CHTA, our partner in improving tourism and health for the region, for organizing this webinar. I know we are really, really sorry for joining late. As you know, this is a very dynamic situation. We were called an emergency chief medical officers meeting this morning So without further ado, I would like to go straight into the presentation to really give you ample time for questions and answers. The presentation is divided into 3 parts. We will really talk about understanding the virus itself. Part 2 will talk about our regional response and what we are recommended. And then we will end with a very short demo on how to get onto our electronic early warning and report system. I want to say before we start, CARPHA is really here to help, as we are the health lead for the region, and we are there to help you, our tourism stakeholders, to ensure we're providing the best and the healthiest tourism product, ensuring the safety of our persons as well as our visitors, so that it really improves the marketability and that competitive advantage of our tourism product. So. Okay, so I have 2 slides before we go into the nitty-gritty. For those of you all who do not know us, we are the sole regional public health agency for the Caribbean. We're an integrated public health agency. In addition to health, we also do environmental health. We have medicine quality control. We have a range of different laboratories, clinical, environmental, drug testing. We are mandated, we are a CARICOM agency, and we are mandated by our heads of government. We serve 26 countries. That doesn't mean we cannot provide advice for non-CARPHA member countries. Our goal is to prevent disease, promote health, and respond to public health emergencies. And we do that within the context that our economies are small, they're diverse, they have varying capacities, varying levels of development. So everything we do, we have to take that into consideration. Plus that we are the most tourism-dependent region in the world. And this is particularly important with our present situation of our coronavirus health situation, where we're ensuring everything we do, we are protecting our tourism product. Oh, I can't get to the other side. Okay, and just a little bit of background, we are mandated to lead in health emergencies. So for instance, when there was Ebola and the risk of Ebola and the risk of SARS and H1N1, we lead that. And we also lead something called the Regional Coordinating Mechanism on Health Security, where we have our CARICOM and our international health agencies that come together, really, where we lead that for a coordinated response. Okay, so I would now turn you over to our resident specialist. Her name is Dr. Stephanie Fletcher-Lartey. We are lucky to have her. She just came in from Australia where she did this type of work. And so she's going to speak a little bit about understanding the threat of the coronavirus. And then I would come back in to talk about our response.
Thank you, Dr. Indar. Now, I just wanted to let you know that CARPHA does have quite a few documents that we have developed on our website. If you go to carpha.org and put novel coronavirus, you will see a suite of products that we have developed for travelers, for clinicians, and technical guidance that might be useful to you. Now, just a little bit of background about this coronavirus. The first reports we had came out in early January, and the report suggested that the outbreak started in the Hubei province of China and in a municipality of Wuhan. And the first reported cases were reported around the 21st of December. And this new coronavirus that has never been detected in humans before was causing severe acute respiratory illness in those initial cases. Now, even today, we still are unsure of the actual origin of this virus. What we know from the information that has been provided is that the initial cases that were infected were people who worked in and around a market in Wuhan. And this market sold seafood and other live animals to the public. So the objective of the public health response to date is to interrupt the transmission of the virus from one person to another. And this virus, as we have said before, the epicenter or the focal point of the outbreak is currently in Wuhan, China. Now, on the 30th of January, the World Health Organization, based on the recommendations of the Emergency Committee of the International Health Regulations, has declared the 2019 novel coronavirus outbreak in China as a public health emergency of international concern. What does that mean? A public health emergency of international concern is it is a situation that enhances the global coordination and cooperation and solidarity. What this does is once a public health emergency of international concern has been declared, that then gives countries and the various international organizations the ability to tap into resources that they may not have been able to tap into before. But it also signals to countries and organizations and corporations that there is a need for more resources, and the country or the area where the outbreak has taken place is unable to cope without further assistance globally. And that's what that means. It is a mechanism through which more global funding sources can be released to address the issue, not just locally in China, but internationally. So to tell you a little bit about the coronavirus. So the World Health Organization has given the name to this new virus as the 2019 novel coronavirus respiratory disease. It is currently, what we know is that it spreads from person to person through coughing and sneezing. It's similar to how the common cold or the flu would be transmitted. So someone may cough, and the droplets from a cough might get, or sneeze, may get into the air, and someone who's close to that person or within a few meters of this person might inhale the virus particles through the droplets, and they could become sick. Now, like the flu, someone may cough, and respiratory exudate may get onto their hands, and they may touch door handles or other surfaces, and that might also be a way in which people could transmit the illness. Now, the main symptoms that people tend to come down with when they're infected with this novel coronavirus are fever and headache, sore throat, cough, and shortness of breath in the early stages. Now, people who have issues with their immune system, people who have illnesses such as diabetes, heart disease, cancer, or other conditions that have limited their body's ability to respond to an infection are more at risk of developing more severe illness, such as pneumonia, breathing difficulties, kidney failure, and subsequently some of these people have died. Now, just to give you a quick update as to the numbers, up until late last night, till the 3rd of February, and I apologize for the error in the date, approximately 20,500 cases have been confirmed globally. Now, the vast majority of these, over 20,000, almost 400 of these cases have been reported from China. Outside of China, at least 26 countries have reported cases to date, and the majority reported from any country has been about 20 cases. So 188 confirmed cases have been reported from 26 countries globally, and only about 12 deaths have been reported. Now, it is important for me to explain to you that in these 26 countries, all of these people, excepting for about less than 5, have contracted the illness within China. The additional about 5 persons who have contracted it outside of China have contracted it from a person who traveled to China who had the symptoms. All right, so from a public health perspective, the outbreak or the illness has not established active transmission outside of China. So essentially, those who have been infected out of China are those who have had a close relative or close contact with someone from China who was ill and had a confirmed illness. Now, as I mentioned earlier, the initial cases were linked to this market in Wuhan, and we believe then that it was transmitted through contact with an animal, which we call zoonotic transmission. Now, the vast majority of people, though, after those initial few cases, have spread it from one person to another, and there's active transmission taking place within the community in China. Now, there are a few reports based on information that we've received in the last week or so that have suggested that some people who came in contact with people before their symptoms began have developed the illness. So it is possible that people might be able to transmit the disease maybe a day or 2 before their symptoms have developed. And this has happened, this is common for some viruses like measles. This is quite common. Now, to date, we don't know of any treatment or vaccines that are effective against the novel coronavirus. What we have seen, though, in the news and a few scientific articles that have been published is that they are trying drugs that have been used for conditions such as HIV and influenza. They're trying to see whether some of these drugs are effective in treating the novel coronavirus. The main treatment that has been used is to treat the symptoms and to prevent people from developing these complications that I've described earlier. So what we call this is supportive therapy. And the medical practitioners are supporting the people to help their immune system to develop that capacity to fight off this virus. All right? Now, we know from the news that there are several vaccines that they are trying to develop to see whether these could be effective. But to date, there are no confirmed or known therapies that can be used. Now, the clinical features, as I said before, I'll go into a little bit more details, is fever and symptoms of lower respiratory illness, which is cough or difficulty breathing, and an epidemiological risk, which is within the last 14 days, before the symptoms developed, the person has visited Wuhan, China, or somewhere in China where there's active transmission, or has had close contact with somebody who was under investigation for the virus as well. Or the person has been confirmed to have the illness. Now, all of these information are available on the World Health Organization website, and they have developed guidelines and protocols for the management of the virus. Now, in terms of what are the actions that have been taken to date from a global perspective, the World Health Organization has declared the public health emergency of international concern. They've produced various guidelines to guide different levels. They've produced guidelines for travel, for the medical community, for public health, and for disease surveillance. And in China, there has been widespread travel bans both in and outside of. So in Hubei province, with the epicenter of this outbreak, they have restricted flights, trains, buses, and ferries, and to some extent even ground transportation from place to place within the communities. All right. Now, the other thing that is of importance to this audience is there are various airport authorities that have instituted several levels of entrance screening or travel restrictions. So the US, Japan, Thailand, Singapore, South Korea, and several other countries have already started to doing screening at their airports. In terms, and several airlines have also canceled flights to and from China. Now, from a Caribbean perspective, there have already been several countries also that have implemented several layers of restrictions. And we will talk a little bit more about that in the third part of our presentation. Now, in terms of disease surveillance, the World Health Organization has produced guidelines for investigating people who have traveled or people who have been exposed to the illness. They've also developed a study protocol for countries to do an initial study to help to define how the virus is behaving in different communities outside of China. And I won't say too much more of that. In terms of the laboratory, CARPHA has now obtained the relevant primers and the relevant capacity to help us to test for the virus at CARPHA starting later this week. And the member states will be able to speak directly with CARPHA's medical microbiology lab for further information on how to send samples for testing. All right? In terms of guidance of ports of entry, the guidance that we have distributed to the member states is in keeping with the international health regulations. And what we are encouraging ports of entry, whether air or seaport, is to ensure they have the capacity to identify suspected cases, to identify people with a history of travel to areas with active transmission, and to be able to identify these people quickly, to be able to isolate them and to prevent the infection from transmitting from persons who are suspected with illness to other passengers or crew. They should have the appropriate equipment and resources to help them to do this isolation and infection control appropriately. We are encouraging clear lines of communication between ports of entry and the public health departments and the various departments involved, and to ensure that there's adequate amount of transportation to safely transmit a person with symptoms to a designated health facility, and also to be able to do their public health emergency activities safely. As I mentioned before, there's various airlines have already canceled flights in and out of China, and this slide provides more information on those airlines that have already started to quarantine or put in some measure of cancellation to flights. Now I'm going to hand over to Dr. Indar to give us an update on some of the actions that have already been taken by CARPHA and go into some more protective measures.
Okay, so we can't, we've seen that there are questions on the chat, so of course we will try to answer afterwards. What I beg you to, if we can get through the presentation, and then I think we might be answering some during the presentation. So what has CARPHA been doing so far as we respond? The goal of our response has been to really be ensuring that we are preparing countries, so we're in the stage of preparedness, and that we are putting proactive measures in place. Okay, so once there's an emergency, given CARPHA is the health lead, we would then activate something called our incident management team, and we will coordinate the regional response. To date, we would have produced 6 different situation reports. It's coming up. Yeah. Right, and these are available. It's available on our websites, and we also would have we would send to our tourism stakeholders for distribution. We have a number of different guidelines. I would go through it in a bit. We have issued press releases. We are coordinating with SEDIMA and CARICOM, our regional agencies, and our international agencies, and we would have convened our regional coordinating mechanism for health security to really have that coordinated approach among the different agencies for response. We are continuing to monitor the situation, so this is why our situation reports, we started every 2 days, and if needs us, if it's required, we would do it every day. In terms of the risks, there are lots of questions on the risks, and this is something we can discuss, but we are saying it's low to moderate because we do not have any imported cases, no reported confirmed imported cases, and because you have to take a number of commercial flights before you actually get to the Caribbean. That doesn't mean we cannot be prepared given the rapid change in nature of this novel disease. So we have called for immediate call. We have had meetings with our chief medical officers in our countries and our ministers of health to really ramp up vigilance at ports of entry. While we're doing all of that and ensuring, all the necessary guidelines go out, we're trying our best to ensure that tourism is not negatively affected through the negative portrayal of health response in the region. So I would not go through this list, but more importantly to say, we have a number of top technical documents on our guidelines. The one that might be that of most importance to you might be our interim guidelines on coronavirus for travelers. We have what to do if we have a suspected case. This is the algorithm. Of course, you will not be involved in this, but it's really good reading material. And guidelines for conveyances, algorithms for conveyances and for contact tracing. Guidelines for ports of entry, whether you're coming through an airport or a seaport. It's important to know what we're doing and what is recommended, so therefore you can then recommend or provide that same information to your travelers. Okay. Now, in terms of travel from China to Caribbean, we want to tell you that there are different levels of risk reduction or different levels of assurance. So presently, the entire province of Hubei remains under lockdown. So, as you know, there's no travel in and out, and there's highly restricted travel inside. As you would have seen, a lot of airlines would have stopped their flights in and out. Before, there are no direct commercial flights to the Caribbean from China. So before a person comes, there are different levels of exit screening that they would have to go through. Point of exit screening. China is screening all persons that is leaving mainland China for symptoms. That includes their temperature and interviews for symptoms and possible contacts. So that's our first level of assurance. Then when that person leaves China, they may then go to either the US, UK, Canada, Panama, or some of the other countries listed below, directly from China. And then at that point, there's a point of entry screening where they're asking, for signs and symptoms and contact tracing. So we have two levels of assurance there. This person might then, depending on, they may be isolated or they may be allowed to travel following that. So if they're allowed to travel, they would have already gone through a point of entry, exit, and then a point of entry screening before they come to the Caribbean. So because of this, we still think, because there are no direct flights, which obviously is different if you take a private or a chartered flight, but because there are no direct flight and because of that levels of screening, we think at this time, because of this, as well as that there are no reported cases, we still think the risk is between low to moderate. but we are asking countries to obviously take a proactive approach. The other thing that is new now is that many countries, as well as CARPHA has now said, avoid travel, non-essential travel to and from China. So this is a third level of protection. We are asking all Caribbean citizens that they should postpone their non-essential travel to China until all clear is given. So our tourists, our business travel, and so on, we are asking that. Note though, if any of our citizens do travel, they must be quarantined or they will be subjected to quarantine upon return. I would go through these are a lot of travel stuff that comes in. If someone does make it through, I want to reassure our tourism stakeholders, we do have protocols in place. We are advising you do not send back. We are advising that if someone does make it, that they should be isolated at points of entry. We are working with our ministries of health to ensure then that all our designated government isolation facilities are well prepared and equipped. So if a person does come in and if they are a traveler, meaning that they are not a citizen, they are not a long-term person with an apartment or such that is here, then we are asking them to self-monitor within 14 days. If there's no symptoms developed, no follow-up is required. If symptoms develop, they become a suspected case. This is where we'll have that monitoring, where they will ask to be isolated and temperature screening would occur, laboratory testing would occur. If the results are then, laboratory results are positive, then they are confirmed case, that person will have to maintain their isolation until they're recovered. And then we will test at the end to ensure. If they're negative for lab results, we stop contact tracing. So generally, if a person is at risk, they would have traveled, they would be isolated and tested. If their test proves to be correct, they will continue isolation, and then there will be contact tracing for person who they have been in contact with. Okay. For persons who are returning, persons who are citizens, obviously, they should not be they should be allowed to return. We are asking them because they have a residence, that we are asking them if they show no signs of symptoms without return at the point of return, that they stay home and they isolate and they provide with contact their healthcare provider. The public health officials would then follow up with temperature screening for 14 days. Okay. If you're a non-citizen and you're returning, but you happen to be a long-term, like a long-term worker who, like a short-term resident, in fact, but so we have a lot of workers who come and they stay for long periods and they are coming back, then they will have to also do self-quarantine because they have a place of dwelling and the same protocol in terms of follow-up. In terms of screening at ports of entry, because of the rapid rate of increase and because of all the international measures that has been taken, even though the WHO has not issued any travel bans, we are saying that we have advised our ministries that they may be implemented if it gives them an added level of assurance. What's more important is that immigration should probe to really find out what's happening. So you may see persons then wearing personal protective equipment, but that will be persons who are port health and quarantine staff. That is persons who will come in direct contact with a traveler. We do not recommend private flights because then they would not have that level, been afforded those 2 or 3 levels of screening. If it do happens, then we would have to follow protocols for commercial flights. For our cruise ships, this has been a discussion in our meeting that we just had. We have been advised that the cruise ships are taking very stringent measures. At the moment, they are now not allowing any passenger who would have traveled to mainland China in the last 14 days, whether they would have been resident or non-resident of China. They have taken all sorts of stringent measures, not even their workers. who would have traveled to China, they have also included Hong Kong, because we know the risk in a cruise ship might be a bit greater because you're in such close setting. We have also advised that if illness do increase and it passes through that level of more than 3%, then obviously, we have advised for 2% threshold for ARI to be used to be more precautionary. The same then will apply to a hotel. We all have our regional guidelines. I don't know if you all would have had that, but we would have passed this on to to chief medical officers as well as national epidemiologists in countries. But what we are advising that if you see that increase, that you report. This is exactly why we have our early alert and warning system, which is a system that allows you to go on your phones where you can just report symptoms. We're not asking for somebody's name. It's highly confidential. So for you hoteliers to be able to get that added assurance, this system is such that it calculates a risk and it tells you if you are passing a threshold. So this is very important right now to know if you need to have a rapid response. In terms of wearing mask, the normal surgical mask is not effective. It doesn't give you that 100% protection, because as soon as it gets wet, the particles may then be transmitted to you. So the true protection is the N95 respirator, and that is recommended for our health staff and our quarantine staff at ports of entry. You may have been seeing a lot of this that is going around. I wanted to bring this up to you. What we are seeing, and this is where you as tourism stakeholders can help us, we are seeing a lot of myths, that it's most dangerous and you would die if you're diagnosed and so on. The facts are that, the common flu is very common and it kills a lot of people, more people annually than the virus. 2% of the cases have reported deaths. There's a lot of panic and hysteria, but the most effective source of prevention is hand hygiene. And we are asking, to have that social distance, and that, you stay at least 1 meter away from persons who might be sneezing and coughing. We also have at CARPHA, and I want to just show you our resources, we have compiled some local myths that we are seeing, like drinking beach is the best solution, and Lysol, and so on. And you can go to our website and find that. There's a lot of videos that are going along. I know in the interest of time, I want to go into prevention. These are the WHO guidelines. We are going to have similar infographics that we can use, but the biggest thing is making sure we have proper hygiene, washing our hands. Of course, we need to reiterate this in our hotel settings. Hands should be washed 20 seconds under, 15 seconds under running water, and then it should be dry and then sanitized. The entire process takes 20 seconds. We need to reiterate that. And of course, reiterate to wash our hands after coughing, sneezing, if you're caring for the sick, before, during, and after prep food, eating, after toilet use, and so on. So these, all of this can be downloaded from the WHO website. We would have similar as well, but this is important to get that message out, immediately. We want to protect others from getting sick. If we are coughing and sneezing, cover our mouth and nose, throat, tissue, clean hands with alcohol-based hand rub, and protect others from getting sick. Avoid close contact if they're experiencing cold and fever. Avoid spitting in public, and so on. Advice to travelers, we advise them to stay healthy while traveling. So again, non-essential travel to China. If you do have a fever, these are things you can advise a traveler. Fever, cough, and difficulty breathing, immediate medical attention should be sought. Okay, so these are some infographics that are put out by the WHO, and they still apply. Avoid close contact with people who suffering from cold and fever and so on. Cover your nose and mouth. And if you are around someone, the best is to stay at least 1 meter away. Okay, so again, moving on. I say all of this to bring us to a few slides. One of the ways CARPHA has been being proactive about health, safety, and environmental threats is through our tourism and health program and having a system of early warning and response. I would not go through this in interest of time, but we do see a lot of illnesses, and 1/3 of that is related to travel. So us as tourism stakeholders have that corporate responsibility to also ensure that in addition to giving our travelers, sun, sun, and sea, that we're also ensuring that we are giving them a healthier, safer product. And this is now being demanded by travelers. We have come up with a solution that we want to address health, safety, and environmental threats by web-based early warning and information system, training, standards, and partnerships. We have mandates. We have the Council of Health Ministers approved policy, and just last week, there was approval from the Trade and Economic Development Ministers. All right? This is really the program, and in the interest of time, we would send to you how to register, but the system is early warning and response to our travelers, this.carpha.org, to respond, to actually register. You actually have to go onto a link. This link was sent by CHTA already, and register, and it takes you through the system. Once you register, it's a very confidential system. It will then the system sends a password. So we don't know your password. Its system sends a password, which then allows you to then go back in and to start entering data. With it, there are these regional guidelines. These are 2 books that was published, that was approved by the CMOs in terms of gives you this instructive, harmonized, and standardized procedure responses for how we respond to illness in an accommodation setting and in a cruise ship setting. There's a lot of capacity building that goes with it. Just last week, we would have gone through a process of reviewing 7 health, safety, and environmental hospitality standards. We are doing this with CrossQ, and before the end of the year, this would go through a process at COTED, where they would then become CARICOM mandated standards. So we are here to support, to train, and implement. And this is the last of the slide. I want to show you one slide here in terms of how you go onto the system, and I will open it for questions. So Frank, in the interest of time, we would not go through everything. I know we have run late, but this is the actual system. It really looks for all the different symptoms, the international reported symptoms, gastro fever and so on. But it really comes down to what's important here is that if you're reporting as a hotelier, the system is built as such that there are thresholds, and it alerts you as a hotelier if you have passed through these different thresholds. So for instance, gastro, the threshold is 2%. It will send you an alert. Right now we are dealing with acute respiratory infections. Then the system will send you alerts so that you know if your increase is beyond a threshold, if it's going to that increase, so you can have a response. Just getting down. For you to actually register, okay, this is what you would need to do. To register, you go to there's a form, CARPHA Tourism and Health at CARPHA.org, Once you fill that form, this is a Google Doc form. So this is the address you probably just need to take down. The only thing, and you submit back, it actually tells you in that form where to submit, and then you can begin the process. You would then see this screen showing up. It would tell you sign in. You would sign in as a facility, not a country. And then you can easily report. It's a yes or no, so it's very easy to report. You know, the questions are very easy. We want to know we don't want to know the person's name. We need to know their likely age and their country and their symptoms. And if you report, then you will see dashboards like this that immediately come up. So for your own hotel, you will see your own trends and your own notifications. So these are the things you would see, and it's interactive. You can scroll on it. It can tell you report over time, by age, by sex, by date of onset, and so on. So I would not go through all of these resources available. There's a video that takes you through it, a YouTube video that tells you how to do it. We can resend again. And there's a demonstration too that's available online. So I think I would stop there now in the interest of time and open the floor for questions. We do have joining us our executive director. So I would also ask her to bring brief greetings as well.
Yeah. Good day, Dr. St. John. Are you online?
Yes, I am. I'm sorry. I was paying attention to the questions that I was trying to answer in the chat. Did you want me to speak now?
First of all, you've been doing a great job answering these questions. We've been monitoring. There's been a lot of good chat on here, and you're clarifying quite a bit. I don't know if we want to continue for a period for additional Q&A, and then you could offer some closing remarks for us, Dr. St. John?
Yes, I think that would be good, because the questions that I am seeing make me realize that there are some noticeable gray areas. So it would be good if I could hear the general discussion. Let the technical officers answer most of the questions, and then I could come in with some other areas.
Very good. And I just want to reinforce, before we get into the Q&A real quickly, the value of this Tourism Health Information Systems network that's been established. It's confidential, as Dr. Indar had indicated. We have seen records of mitigation of impact on companies, as certainly on the lives of employees and tourists. Through this confidential reporting system, they've been able to nip things in the bud and prevent a situation from getting out of hand, and also diagnose things correctly, getting to the health authorities locally. So I can't underscore the importance of more hotels signing up onto this. We've got about 200, but we've got over 2,000 hotels in the region. So we really need to see those numbers go up. It's for your own protection and reputational value. It's really important, not only for the reputation of individual properties, but also for your specific destinations and the Caribbean as a whole. So use these tools. They've been developed with the support of the Inter-American Development Bank and others to help make our industry better, healthier, safer, and as well as our employees. So online questions. We have one question that says, does this virus last on mail? We receive a lot of mail from China and would like to know if there is a protocol on handling mail. Is there anyone from CARPHA's side would like to take a stab at that?
No, it doesn't. No, the quick answer to that is no.
Okay. Even if it's express mail, huh? Okay.
Just gloves and.
That's why I asked the question about snail mail. Because if this is snail mail, it's going to go through processes that no virus can survive. However, I just heard Stephanie saying something else. So Stephanie, please go ahead.
Hi. What I was just saying is your routine measures for handling mail and any suspicious packages would be, do that routinely. And I would expect that if mail is coming from that far, it would have gone through quite a few processes before arriving in the Caribbean.
Yeah.
Okay. Go back to that one.
I'm also seeing on the chat that they haven't been able to see the test registration. We will put that up back, that last slide, how you register. And also to note that we are launching Healthier, Safer Destination on May 29th. And this is really timely for us because hotels that are using the system, will have, that would be the first requirement to be awarded as a healthier, safer destination, because you are taking a proactive measurement for ensuring the health of your travelers.
Okay. We have a question from the Minister of Tourism from Grenada asking if, she's basically saying, I believe that this is a very timely intervention. We share the concern about small sea craft entering our borders. Any possibility of a regional or sub-regional approach to this? CARPHA, have you had any discussions with the health authorities in the region about that type of possible exposure?
So far we have been having discussion with the aircrafts, with the bigger aircrafts, not the small ones, but the same protocols do apply. So there would be that screening. And if those small sea crafts, I'm assuming they are not directly coming from China, so the risk is reduced. So what we would do though, we would take that into consideration, and if we can be pointed to the right direction, if there's an association about this, we can then, do a small presentation for them.
Okay. In terms of the virus spreading, right now it's, primarily confined to China, but do you foresee that the virus will start spreading rapidly over the next month or so, more within the US and Europe, so that we become even more exposed in the region as well?
This is Stephanie Fletcher-Lartey here. Look, we believe that like most viruses, there will be that early peak and then it will plateau and then drop off eventually. From what we've seen in the last couple of weeks, there has been spread to several countries, and that reflects global travel and the ease with which people can move from one point of the globe to the next. So we should be quite proactive and prepare should this actually happen. The other thing that I wanted to just add, that with if the measures at the ports of entry are done well and mindful of human behavior, that will provide some kind of buffer. However, there are schools of thought that with excessive levels of restriction to people may begin to go underground, and that is something we don't want to happen. So, preparedness is the word for the season. Prepare, and then prepare some more. So prepare and anticipate. It would be great if it doesn't happen, but if it does, we hope that we would have been prepared to respond accordingly.
Okay, we had a question from St. Go ahead, please.
May I say something?
Yes, please.
So one of the things that I did week before last when I was in London, I visited Professor Ferguson, who is one of the experts that has been guiding WHO on the spread, the modeling for the spread of the virus. There are a few factors. There are a few factors at play here. One was the fact that this is China, so in terms of sheer volume of travelers, I think that you will be able to supply the percentage, but especially in the last year, the sheer volume of tourism traffic has been huge. The other thing is that we had Chinese New Year, and Chinese came from all over the world into China to have Chinese New Year celebrations. So I raise these two factors to say one thing. The way in which China responded in terms of trying to restrict travel, first in Wuhan city and then in Hubei province, was extraordinary. So there was not only the restriction of travel until not even, you couldn't even drive around in your car in Wuhan, but there was also exit screening, not just temperature screening, other screening, as Dr. Indar indicated. And then there was also the great curtailment within Wuhan and in areas of the Hubei province, because right now it's mainly the Hubei province where there's established person-to-person transmission. There was great restriction of New Year, Chinese New Year celebration. There was discouragement of people coming in, and for those who left, there was exit screening. But although all of that was done, we still know that some people are traveling even now from China into the Caribbean region. And so one of the things that CARPHA has been doing is following very closely what WHO has been saying about spread. And WHO has indicated that the risk is high. But those slides that we showed you about the vessels, mainly planes, restricting travel into and out of China, also the kinds of protocols that we heard that the cruise industry has put in terms of screening of persons who have come from China, that will delay the spread considerably. I will not be the one to say what the spread will be like. I will not be the one to encourage any of my officers to say that either. But we are hoping for the best and preparing for the worst. That worst, from our perspective, it's also very important to understand what is the character of the overall outbreak. And so far it seems that the majority of people, even when they are very ill, they recover. And this is how we are looking at the illness from two perspectives, not only spread, but the type of way it is affecting persons in China. So I know that tourism is anxious. We're all anxious. But I think we need to approach this intelligently and not play into the media and fake news frenzy that has come around this outbreak. It is unprecedented. And in the Caribbean, the volume of fake news, the ways in which people have presented news, so it is in a format that seems credible, but interspersed are scaremongering and conspiracy theory insertions. This also is unprecedented. So I am hoping that this webinar will go a far way into bringing some I'm trying to find the right word. some level of processing so that there is not a fueling by the tourism industry in the Caribbean of the media frenzy and the fake news that has been surrounding this outbreak. CARPHA is producing videos and other things to deal with a lot of the questions that we have been hearing. We're doing myth busting and in a catchy manner so that everybody understands it. And we want you to focus on the credible sources. So I am not God, I am not a magician, I am not a modeler. So I don't want to say how it will spread because even WHO isn't saying that. But I want us to prepare ourselves and to react intelligently as to how we deal with this issue.
Very good. Thank you so much, Dr. St. John. I think and on that note about the media, also what we can control more effectively is the social media as well. So you've been given facts today. The social media can be incredibly dangerous. It spreads rapid fire, and there's a lot of fake information that gets on that. So you've been armed with some facts today, and we'll continue to provide, with the support of CARPHA, you with additional facts. I want to thank CARPHA and the attendees who participated. This will be available to all attendees. We'll email it out shortly, and we'll continue to provide information. We know from experience that we can mitigate this impact. We've done it with other things in recent years and other incidents and vectors, situations, and so on, and we can do that, but it requires ourselves as an industry being informed, being proactive, and basically controlling what we can control. I want to thank all the participants and presenters today, and we'll continue to do our best to be diligent in providing you with accurate and timely information.
Frank, could I just add, we've seen a lot of questions. I don't know if we have answered all. If you send us the questions, we can send email responses. We can send the presentations if needed. I want to remind us all too, this is the flu season. You would see people with a cold and a flu, and it may not. In fact, more likely to be flu than coronavirus. There are other viruses that are going around, so we have to be vigilant of that. And we have to train our frontline people, which I think I'm seeing this from Mr. Brathwaite here, to make sure that we can recognize that and to take measures, for coughing, for sneezing, hand washing. Those are the things that are important. Encourage people to wash their hands. Encourage people if they're sneezing, and to cover their mouth and their nose when sneezing. So those types of message would go a long way, because it's not just about coronavirus, it's about preventing someone from getting ill. And, I think we are the Caribbean people, we love to hug and we love to, kiss everyone. But because we're in the flu season, keep a bit of small social distance. We're saying 1 meter apart for now, if you're seeing someone who is sick, who is coughing.
Save your hugs for the summertime.
Yes.
Very good. We will share this information. We will share some of the questions and answers as well. And thank you everyone for participating. Hopefully you found it very useful. We certainly did.
Thank you for this opportunity that you have given CARPHA to interact with your members.
Very good.